It could be your sister, your child, your parent, your grandparent, your neighbor, even your colleague. Opioids do not discriminate. The opioid crisis has become a nationwide issue. It was declared a public health emergency by President Trump in October 2017 and a disaster emergency in Pennsylvania by Governor Wolf in January of 2018. The CDC notes Pennsylvania is one of the 5 states hit hardest by the opioid epidemic, and it is seeing increases in overdoses across age groups, racial ethnic groups, and in urban and rural areas. In Pennsylvania, approximately 13 people die a day from an opioid overdose, according to a study from the University of Pittsburgh. Pennsylvania's 7 public media stations have joined together with the Commonwealth of Pennsylvania to confront this crisis head on. In this program, we'll tell compelling personal stories of hope and survival. In addition, we'll provide information and help direct people to the resources they need. After being involved in a serious car accident, Alexis Johnson was prescribed pain medication. She struggled with years of addiction, multiple overdoses, and jail sentences. Today, she is a successful model and a motivational speaker with a message that spreads hope. And for children with parents battling addiction, the crisis can be even harder to overcome. As the number of people struggling with opioid addiction increases, so does the number of children entering the foster care system. We sat down with a teenage girl who lost both parents to drug use. She ended up in the foster care system and has been struggling to find her way. Meet Alexis Johnson and Paris.
So I was born in Scranton, Pennsylvania, and I grew up in Archibald, Pennsylvania, and I had a beautiful upbringing. I had my life ahead of me. I came from a good family. There was really no drug use in my family. Where my life really took a turn for the worse was when opioids were introduced into my life. I was working at a bar in Scranton and I was rushing to get to work. I was running late and I hit a really bad rainstorm and I hydroplaned. It was an extremely bad car accident. I was prescribed Xanax and Percocet for everything that had happened, and that's where I learned how to start abusing doctor-prescribed medication. In 2008, I didn't know anything about addiction. I wasn't aware of what was happening to my body. I just knew that I didn't have this pill and I felt like garbage. So when I took the pills, I felt better. And then, you get more pills and your dosage goes higher and then you start taking more. And at one point in time, I was actually getting over 600 Percocets a month, and it got ridiculously out of control. The pills weren't working anymore, so I ended up graduating to heroin. I started off sniffing it and eventually started shooting it. I would cry to God every day to take my life. I would sit in a mirror and just pick and pick. I actually took an X-Acto knife to my face and I cut my face here and all over. I have a massive scar. I look like the night of the living dead. I was a walking corpse. My life now is awesome. At almost 3 years sober, it feels incredible. Fitness is such a huge passion of mine. I love bodybuilding, but I also love pushing myself way past limits. It breaks me down, it builds me up. It's cool because I've been able to smash a lot of barriers in the fitness world for recovering addicts. I did my first fitness competition in April of last year. It's WBFF, which stands for World Beauty Fitness and Fashion Federation. I came in top 15 for my first competition. I have been in numerous publications. I've been on the cover of magazines, and Status Fitness magazine did a huge article on me about my story. The addiction used to be such a taboo, and now When I do these photo shoots, everybody wants to bring my story into it. My biggest modeling accomplishment, Playboy Australia 2018. I'm one of the first models that they were able to do the story on addiction. Everybody, including women, have supported it because of the integrity and my message and wanting to motivational speak and help teens. My goal in life is to help people and give back. What I've been through in my life is probably worse than most people have nightmares about. I've overcome so much. My only goal today is to make sure that kids don't walk down the same path I did.
A lot of my childhood has holes in it. I don't really remember. I remember pretty much the traumatic things more than the good things. I don't even think I could tell you one good thing about my childhood, to be honest with you. I saw a lot of things that I shouldn't have. I have seen things that I don't even think I should see now at my age. I went to parties with him because that was my dad and I didn't want to be without him. I remember some days I would just wait by the window to see when he was coming home, and sometimes he didn't at all. Sometimes he stayed out. When I would go to parties, I think I would be the only kid there. He would be drunk and doing whatever, and there were some parties where I just couldn't find him, and I was alone, and I can't imagine the things that could have happened to me.
We do not have enough families to meet the need because we need families for our teen population. Those are the ones that's harder to find family for, because family will come forward for the newborns and they'll come forward to the 4 and 5-year-olds, but they're not coming forward to the 14 and 15-year-olds. And all the agencies struggle with this.
I definitely had to get used to it because I wasn't used to the whole family aspect, and the kids just clung to me, and I wasn't really used to that either because I never really had healthy relationships.
She never got to be a kid, never. My early childhood memory is Disney World. Her early childhood memory is calling a prison looking for her mom. So she went right from being a little child to doing adult things. And statistics say that she has an uphill battle. Statistics say teenage pregnancy, poverty, homelessness, drug abuse, alcoholism. So do I worry because I'm educated on what can happen? That's why I'm worried.
We really try to educate our families because they don't understand sometimes that you can take the child out of their environment and they can be with you 3 or 4 months, but that's not enough time, especially if you have a 14-year-old that maybe has been living in a situation that's been chaotic most of their lives. It's going to take a while to unpack that bag for them. It might take a year or more as they kind of adjust to your home and you adjust to them, and they don't feel safe a lot of times, so they challenge you for that. So it does take time to kind of help them and get the services they need and help them to know that this person is going to stay with them and not leave them. And that's ideally what we hope to get from our foster families, that they can just look at them and say, there is no one like you, and I will always care for you. And that makes a huge difference.
Technology is now used in battling opioid addiction. Today, pharmacists can now lead the charge in helping those addicted to prescription pain medication get treatment thanks to prescription drug monitoring programs. But first, hear the story of a former well-known sportscaster from Philadelphia, Don Tollefson. After his addictions landed the famed television personality in prison, Tollefson wanted to find a way to give back.
Active addiction is a really bad horror movie. In my case, the fact that I could go on television and do the sports or the news after I had consumed alcohol and or drugs continually convinced my addictive mind and my delusional mind that I was okay. My name is Don Tollefson, and I'm a recovering alcoholic, drug addict, and an ex-felon. I came to Action News in 1975, was there for 15 years, and then worked for the Philadelphia Eagles as a preseason play-by-play announcer and a stadium announcer until 2012. I was making terrible decisions. I had a big gulp of vodka with a little tonic, and I'd start popping pills, and I started over promoting what it was I could do for the donors. And all of a sudden in 2013, I realized that I was in a position where I couldn't come through on these trips and these tickets that I owed them. Some people went to the police, and I was indicted by the grand jury. I was charged with 2 felonies of theft by deception.
I am Shauna Roeder, and we're in Harleysville, Pennsylvania. My parents had started a ministry for inmates, and they knew that he was in prison, so they reached out to him after he got out of prison. My mom knew what he was doing, trying to help people with addiction, so she reached out to him, hoping that he could help me with my addiction.
Originally, I got to know Don just on TV, and when I heard that he was incarcerated, my wife and I have been doing a ministry called Cellmate Bible Ministry.
As any inmate knows, mail is a huge, huge thing when you're in prison. It's something you so look forward to every day. Lois and Gary put out an incredibly inspiring newsletter, and it made a huge, huge difference in my attitude while I was incarcerated. It brought hope. And when they presented me with the opportunity to work with Shauna, I felt very honored by that.
I wasn't ready for the help. I just wanted to keep doing what I was doing.
She's been struggling pretty much with alcohol for several years. And we've been seeing a positive change in her life, but it's really the last several months that she's been in contact with Don. She's been growing in the right direction, a positive direction.
In prison, you have an enormous amount of time in your cell to think about your life. And I said, you know, when the opportunity presents itself, once I'm released, I'd like to see, you know, would I be comfortable having a street ministry to help addicted people? Let's get something to eat first.
My name is Jasmine Johnson. We are in Kensington area of Philadelphia. This is what we would call Needle Park. I was on the streets of Kensington for 6 years, 6 long years. And when I got here, it was like a big playground of drugs, you know, and partying and fun. We ran these streets all around Kensington, doing whatever we needed to get what we needed to get high. I went to jail. The judge sentenced me to go to a program, to a rehab. From there, I was put on methadone, and then I got pregnant with a sugar daddy, you would call it. And I told myself I needed to get it together. I had to learn how to stay sober.
I met Jasmine along with her boyfriend and Aiden, her 3-year-old child. And it was at a time when they were going to methadone treatment at 8th and Girard, but they were homeless.
He came and met us one morning. He met Aiden, fell in love with him. We talked, you know, just getting to know each other. You know, a lot of addicts feel that we're stuck here. Like it's just a loop that you can't get out of. It just, this is my life and I'm gonna be like this till I die. He taught me that I could still do more with my life. It's very important to have a support group. It's so hard to do it on your own because cravings are gonna come. You're gonna have using dreams. You're gonna have triggers. I could be walking down the street and I see a little cut off block. Wow, you know, that would be a good spot. The number one thing, you do not want to isolate because your mind is extremely powerful and addiction is cunning.
having somebody that went through addiction helps me because they know what it's like to struggle. They're not judgmental at all, because family for a long time was kind of judgmental and said, you know, just stop.
Be available to someone you've met who's struggling with addiction. Be a good listener. Don't come to someone on the streets of Kensington or North Philly or Germantown and say, hey, here's what you need to do. Ask them what they want to do.
Years ago, I was much more judgmental. I've grown to realize that now everything isn't just black and white, cut and dry. Nobody can help them. They have to do it on their own. And until they're ready to take help and move forward, there's nothing you can do. It's quite a struggle. And to see a person get down to the bottom and work their way up, it's really something special.
Prescription drug monitoring programs are seen as one of the tenets to fighting prescription drug abuse across the country. In our state in Pennsylvania, our Department of Health now oversees it, and basically when pharmacies dispense a controlled substance, whether it be a Schedule 2, 3, 4, or 5, and that covers all your opioids pretty much, it covers all your benzodiazepines, it covers any controlled substance, they have to report it to a state database. And that state database then collects, you know, okay, here's these drugs that were dispensed at all the pharmacies across the state, here's the prescribers that prescribed them. And they have to report that within about a day. So it's kind of real time, if you will. So now what happens is you have all this data in there. It can be used by law enforcement if there's ever a concern, but also prescribers and pharmacists now have access to that, and they can go in. So if I have a patient, let's say as a pharmacist that comes in, there's going to be times that I have to query this data depending on what's going on, or I can if I think there's a concern. So what happens is I can go in and see, are people going to multiple doctors and getting multiple prescriptions, you know what I mean, that might interact or might lead to an overdose, or maybe they are doctor shopping and abusing. So it helps catch those kinds of issues, but it also helps clinically as well too. And then doctors that are prescribing can also go on and see too if they've ever gotten anything. Now one of the issues is every state has their own database, okay? So where we are in Erie, we're a half hour from Ohio, we're a half hour from New York. So prior, people could cross state lines and we didn't know what was going on. But now the states are starting to share data. So I think Pennsylvania now shares with about 16 states. So I can even see when they're going now to Ohio doctors and getting a controlled substance, and New York or getting it filled there or whatever as well too. So what happens with the PDMPs is the pharmacist or the doctor or the prescriber can go into this while the patient's there or before they see them or while they're attempting to fill their prescription, and they can see what's going on, and that information can be analyzed by the practitioner, and then that can it's a tool in their decision-making process. So if the pharmacist would see, oh wait, you're going to 3 other doctors and you're getting 2 other medications, before I fill this one, I want to talk to these other doctors and make sure that you need all these together or something like that. Or maybe the prescriber queries it and sees, wait a minute, you're also on this medication or something, you know what I mean? So depending on what's going on, if it's truly a clinical problem, then the healthcare providers can communicate. If it's an issue where someone thinks that they're addicted or that they're doctor shopping or something like that, that could be the first step to talk to them about possible treatment or something as well too.
Decisions that addicts make can affect their children for the rest of their lives. We'll visit Hogar Kriya in Freemansburg, where addicts submit to an intense treatment program aimed at restoring the whole person and reclaiming lives. But first, let's meet Lisa Nye, who used heroin until she discovered she was pregnant at 23 weeks, and her baby, who was born dependent on opioids. Stigma prevents some pregnant women from seeking help, the very help that saved the lives of Lisa and her baby.
My preemie baby went through withdrawal. She's 5 days old. Her name is Isabella. I'm in the methadone program, and she's born addicted to the methadone. It was hard to watch her shake and tremor. She receives morphine to help with her withdrawal a few times a day. The third day was the hardest. Yesterday would have been day 4, and it was better, but today's probably the best day. It's day 5. We both started using together, and then from the Percocet, they're expensive, and that led to heroin. Heroin's cheap, and it was just snowball effect. It was horrible. He's incarcerated for some of the stuff that the opiates caused him to do. Waking up, it's a struggle. All you can think about is, how am I not going to be sick today? How am I going to get the money? What do I have to do to get that money? It's disgusting. It's not a way of life. I wouldn't wish it on anybody. And I used up until I found out I was pregnant with her, and I was 23 weeks along. Just because of the judgmental people out there, like, she's using and she's pregnant, but when you're pregnant and you're using, you can't stop. I was ashamed because I was using while pregnant. I was scared. I didn't want people to know, because I don't want someone to take my child from me because of a choice I made, and now I'm an addict. I'm in treatment with roughly 6 to 8 women. There's probably hundreds of women out there, and they're scared. They don't want to be judged. They don't want that fear of their baby getting taken away. I just wanted to do whatever it took. I'm over 90 days sober. I feel good. I don't know. Seeing your child through sober eyes is, I don't know. It's awesome. She knows that we were sick and we had to go to a special hospital with special doctors. But I'm ready to have her back and let my mom be a grandma again instead of a mom. I'm excited because I'm sober. As soon as I find housing, like, we can be a family again, and it's like a second chance. I can start over, like a clean slate.
Before I came in here, I had a couple months, I was just out on the street after they took my daughter away. I struggled getting clean and staying clean for my whole life. So, my name is Jeremy Wheaton. I'm 35 years old. I'm from Palmerton, Pennsylvania. I came here about 22 months ago. They opened the doors, welcomed me. You know, I was resistant at first, but as soon as I started, submitting to the program and doing what I had to do, I started changing everything about myself.
Hogar Crea is a therapeutic community. We call it Hogar, meaning home, and Crea is the center for the education of the character. That's what we call Hogar Crea. After 20 months, we guarantee if they go through the process, you will have a new member of the society that would know what is the role in society. They have to learn how to get familiar with the rules and regulations of the programs.
How you doing, Pedro?
All right.
Your surgery all right?
Need a little
Good?
more better.
All right. A little more better. Hogar Crea, Freemansburg, Brian speaking. How can I help you? And how much is the fee? What makes this program different is that, like I said, you're doing it for yourself. and they put it all on you. It's your accountability, your responsibility to do anything in the program. They're not going to force you to do anything at all, but they want you to take initiative to do the things that you need to do to better your life. Well, it's designed to make a structure out of your life, to have accountability and responsibility. We do work brigades. We go and do landscaping brigades. We do moving brigades. We work at warehouses. We do the sale of our baked goods. We do everything we can think of.
You are in charge of a whole home, not just yourself. You got 20 residents, more and more, that you have to take care of and make sure that everything gets done the way it's supposed to. You have to manage, the house. You got to make sure bills are paid. You got to make sure that the guys are getting therapies, and you're managing the food, everything. I have a little girl that I'm going to be taking care of, so it really taught me that, okay, I can take care of our house, I can take care of her. When you go to another facility, they don't give you that much responsibility. One, it made me feel good that people were trusting me again. When you're in addiction, you lose a lot of trust from a lot of people. I think in recovery, you need that part too. That really helps, to have that responsibility, to be able to know that you can do this. You have that responsibility, take care of things.
With opiate addiction, it takes 18 months to actually rid it of yourself. It's why longevity here it's really important, because if you're not going to be here for long term, you're not going to change. This was the first program that would accept me as a long-term solution to my problem. But you have to be strong. If you're not, what's the point of being here? Until someone says, look, I've had enough. And when they do, this place is waiting. It's always going to be here.
Living in isolated rural counties of Pennsylvania poses unique challenges to those seeking treatment. Medication-assisted treatment is called the gold standard of addiction care by its advocates. However, negative public perceptions surround this form of treatment. We'll travel to Center County to meet Jamie Durst, who discusses receiving the treatment she describes as life-changing. But first, hear the story of one community agency that is working to make recovery treatment more effective for those who choose that path.
In a rural community, if you're seeking treatment for an addiction problem, one of the biggest barriers is simply locating a provider who can help you and then getting to the provider.
In northeastern Pennsylvania, there's only a handful of licensed step-down services.
Just for example, in Susquehanna County, there are 2 sites where there's addiction recovery counseling available, one in Montrose and one in Susquehanna. But if you live any place else in that county and you want help for that problem, you've got a lot of traveling to do. I know that someone had wanted to open an addiction recovery center in Susquehanna prior to the hospital opening one, and they ran into some pushback from the local community.
There is that not in my backyard mentality. I don't want those type of people coming into my backyard. Those individuals are already here in your community. They're just untreated.
Addicts are a hugely diverse group of people. Upper class, lower class, doesn't make a big difference.
In northeastern Pennsylvania, it wasn't taking place in bedroom communities. Well, now all of a sudden it did.
And a lot of patients are started on prescription medications, but not by a doctor. They go to a party and somebody's got a bottle of prescription medications and they're passing them out. And that's how a lot of people get started.
It's not a walk-away drug. Your body becomes physically dependent on those medications.
It's not a question of getting high anymore. This is a question of just feeling normal. We've partnered with the local drug and alcohol counseling program, which is called Treehab. This guy comes into the emergency room, he's had an overdose. And in the old days, the ER doctor, which might be me, would get him through his overdose, and we'd give him some recovery material, call these people in the morning, and about 40% of those people might actually make the phone call the next morning and try to get some recovery. A warm handoff is a relatively new term. That same person comes in, and as soon as they're identified as someone who has an addiction issue, they pick up the phone and call the certified recovery specialist. And those people show up, start the counseling immediately. If medication is needed, You provide the medication then. So instead of hoping they'll call tomorrow and you get them in, you get in and you get started right away. You get about an 80% response rate instead of a 40% response rate.
Even when you have treatment services available across the street, the engagement level has a lot to do with the individual's willingness to want to get help.
If you're thinking about pursuing recovery and you haven't made that step yet, call one of the counseling programs. Get in, get evaluated. You may find out that it's something you want to do that very day, or you may decide, I'm going to keep talking to them, it sounds good. Maybe I'll turn around in a week or a month. If you don't pick up the phone and call a counselor, get in and see a counselor, then the next time you get in to see someone is going to be when you overdose, when you go to jail, when your family says you can't come home anymore.
You don't realize how great it is when you're able to be the person you're supposed to be.
If you have enough motivation to even call a counselor, they can usually help you out.